His Excellency, the Governor of Andhra Pradesh has arrived. Kindly take your seats. We welcome His Excellency Shri ESL Narasimhan, the Governor of Andhra Pradesh, to please come on the dais. On behalf of the Organizing Committee of Transforming Healthcare with IT, I extend a warm welcome to each one of you. Let us begin the proceedings with the National Anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड उत्कल वंगा विंध्य हिमाचल यमुना गंगा उत्कल जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तव जय गाधा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
I request Dr. Ganapati, President, Telemedicine Society of India, to welcome the gathering.
Your Excellency, Sri Narasimhanji, Honorable Governor of Andhra Pradesh, Dr. Pratap Reddy Garu, Doyen of Indian Healthcare, Sri Harinarayanji, Chairman IRDA, Sri Sangeeta Reddy, Executive Director, Apollo Hospitals Group, and the moving force behind this conference, distinguished delegates from all over the world, ladies and gentlemen. On behalf of the Organizing Committee, it is my privilege to welcome all of you to the valedictory function of the second edition of the Congress Transforming Healthcare with ICT. In most conferences, the final session is a formality to bid adieu to all the participants. Looking at the unbridled enthusiasm of the attendees, the star-studded personalities on the dais and the agenda, this session could very well be mistaken for an inaugural session. It is difficult to believe that we have been listening to 64 lectures for 20 hours continuously since yesterday, and that we have seen various facets of e-health in action displayed at the various stalls in the trade exhibition. It appears that even if healthcare information technology has not yet come of age in India, the conception process is certainly over. It also appears that this is one situation where even with a quicker gestation period, which is likely to happen, the conceptus will be delivered fully formed, ready to face the challenges of the ever-changing new world. With the expectations of all the stakeholders in the healthcare industry reaching an all-time high, what else do you expect of the World Cup winners? We are now convinced that the second decade of the 21st century will probably be best known for the radical transformation of healthcare using ICT, particularly in emerging economies. During the last 2 days, we have learned that e-health alone can bridge the health divide between the haves and the have-nots. Today, we are on the threshold of a revolution called information medicine. Deployment of ICT in healthcare will certainly change health outcomes and ultimately be as important as advances in diagnostics, treatment, and even genomics. The first generation of e-medicine enthusiasts should, however, not forget that technology should only be used as a support to treat patients and not viewed as a goal in itself. The challenge today is not confined to overcoming technological barriers, insurmountable though they may appear. It is true that available technology still has considerable scope for improvement. Rather, the challenge is why, where, and how to implement which technology and at what cost. A needs assessment is obviously critical. The takeoff problems facing e-medicine is legion. It is our dream and hope that within the next decade, e-health will be an integral part of the Indian healthcare system. What is required is not implementing better technology and getting more funds alone, but changing the mindset of the people involved. E-medicine should only be a mouse click away. Ladies and gentlemen, may I once again welcome every one of you here to actively take part in a movement, a crusade, which can make all the difference. It was Mahatma Gandhi who said, "Let us be the change we want to see in others." We are in a stage of transition. All transitions offer great opportunities and still greater challenges. The times demand innovation. The times demand boldness. The times demand courage and conviction. For the progress of any society, we need people who worry about their responsibilities, about the future, about the consequences if they fail to deliver the goods. People who enjoy working under stress, like Sangeeta Reddy. People who believe in what they are doing. Plans alone are insufficient. People are required to implement them. People with a capacity to look around corners, with an obsession to get things done, not today but yesterday. Let this conference not just be one more meeting. Let it be the beginning of a realization that we would be doing injustice to our brethren, to our children, to our grandchildren, and even to those yet unborn if we do not incorporate the obvious benefits of ICT into the very core of our healthcare system. Improbable, yes. Impossible, as Dr. Reddy has shown, no. It was Walter Hugo who once remarked that nothing can stop an idea whose time has come. The response to this conference clearly shows that this is the right place and the right time, and what other place than Cyberbad to kick off this, to transform healthcare with ICT. Ladies and gentlemen, we sincerely hope that you go back with this thought and take steps to make this vision a reality. May I once again welcome our distinguished invitees on the dais, and particularly you, the Governor, sir, and all our delegates to this concluding session. Thank you.
We are privileged to have in our midst Mr. J. Hari Narayan, Chairman, IRDA. Sir, may I request you to address the gathering.
Honorable the Governor of Andhra Pradesh, Sri Narasimha Garu, the Doyen of Indian Medicine, and Hospitalization and Modern Medicine Service, Dr. Pratap Reddy, the President, the leader of telemedicine of the Apollo system, Dr. Gapati, ladies and gentlemen, it's indeed a privilege to be here this afternoon with all of you and to share such a distinguished as. As I see, when I went through the conference agenda these past 3 days, there have been very eminent persons who have been addressing you on various matters. But I think, looking at it purely from a non-health but health-related subject, insurance, I think I'm the only one who will be talking to you about this. I thank you for this opportunity. Insurance should not be an afterthought. It should be an underpinning of health initiatives. I think across the world, that's what they have found. That ultimately, it is only by pooling risks and pooling and gathering knowledge together that it will be possible to meet the costs of modern medicine. To give you a perspective, in USA, for example, the per capita expenditure on health is something of the order of $8,000 per annum. In the UK, it's a little less than that. It's about $5,000. In India, it's about $68. That's about the difference in scale, in costs, which we have to address. It is quite clear that the models of health care which have been developed and implemented so brilliantly in societies such as UK and Germany and so on, perhaps would be just far too expensive to replicate and model and duplicate in India. Not just because in terms of its absolute cost, but purely in terms of the scale of operations which we may have to consider when dealing with a continental-sized country, which of course, as you know, is going to be the most populous country in the world very shortly. I'm sure that's only a doubtful benefit, but nevertheless, that'll be a fact. I think yesterday, and given this scenario, obviously, duplicating medicine as it's serviced, as it's practiced in these societies would not really work here. We will have to find and carve and craft an Indian model. Certain steps and certain auguries are already visible. There are a number of green shoots, as it were, in someone else's favorite phrase. But it will take time, it will take nurturing, because before these can become shrubs and trees. And I think it is that long journey which ICT and the promise of what Dr. Reddy and his team wish to make, I think that is the fruition of that effort. Yesterday, when the Honorable Chief Minister of Andhra Pradesh had spoken to you, I'm sure the newspapers reported that he did talk of many things, including the insurance-based health initiatives of the state government of Andhra Pradesh. You may be surprised, or maybe not so surprised, because everything in India has to be in gigantic scale in terms of the numbers of people which we'll have to address and meet and cover. You'll be surprised that the two largest health insurance programs in the world today are the central government-sponsored RSBY program, which covers all kinds of hospital-based, no doubt, but interventions including medical interventions, and the Arogyashri program of the state government of Andhra Pradesh, which has been duplicated in Tamil Nadu also, which look at surgical interventions. But what is remarkable apart from the scale is just the cost. The surgical interventions, for instance, in Andhra Pradesh, these are bid out, by the way. These are not government-administered schemes in that sense. They are certainly government-financed, but they are run and financed on pure insurance principles. To give a scale of these operations, the RSBY, for example, covers something of the order of 27 million at last count people in India. The entire insurance sector covers 60 million, out of which 27 million is the RSBY program. That gives the size of these kinds of operations. But to get back, the RSBY program gives an insurance cover to meet costs of up to 30,000 at an annual cost which is bid out. It was 400 rupees or thereabouts last year. I think when I checked the numbers the other day, the latest bid was closer to about 360 rupees, and that is for a family of 4 people. It's a family floater arrangement. That means any one of the group, or any one member, any member of the family will be eligible to be covered up to that limit within that year. So at 360 rupees, it comes to something little less than $10 per head, per capita, per annum. The Arogyashri, which covers surgical interventions, and I think the Chief Minister mentioned it yesterday and gave some numbers and so on. This one covers surgical interventions up to a cost of 150,000 rupees, which in certain cases can go up to 200,000 rupees. And from last count, the program covers about 600 or 700 various procedures. This one, the per capita bid out is $2.50 per capita per annum. I had mentioned these numbers in an international conference on insurance in Brazil, and I was met with disbelief. Everybody said that, well, you might be charging or costing this amount to the government, but obviously somebody else, somewhere else in the whole value chain is meeting the cost, because at these prices it simply cannot work. So I requested them to come over, and the insurance, the Association of Insurance Supervisors had a seminar here in Hyderabad last year, and several of these members had come here to look at the entire program, its dynamics, its economics, and so on. And they were quite satisfied, though totally astonished at what they had seen. Let me tell you that the companies which are involved in this program, as long as they do it repeatedly in the same year to year, in the same geographical space, they are turning a profit. There's a combined ratio which is an important metric as far as the insurance company is concerned, the insurance industry is concerned. The combined ratio is quite reasonable and quite healthy. Initially, when it started, there was a support from reinsurance, but that is to be expected. But as we go along, once the pent-up demand for various types of surgical interventions are in place, later on it is just on a maintenance mode, and then it's eminently doable. The issue which I'm trying to highlight, and I think I would like the support of the medical fraternity, is that we need to build up a template, a model of what kind of health insurance or health administration or health support we require in our country for all its millions. If it is going to be as it has been in the past, that is largely supported in principle by a free medical service run by government, state governments, the entire setup of government, district, taluka and PHC hospitals and so on, it might sound good on paper, but it has, that whole mechanism has decayed and does not reach out to people and is really a dysfunctional system. So that obviously cannot be a solution. Nor can be a solution where the entire cost is met either by an employer or by the government or by an individual pocket. India has the dubious distinction of being the country which spends the maximum out of one's own pocket for medical cover. It's close to about 80 or 85% of the total expenditure is met by individuals out of their pocket. And that proportion of private expenditure is unmatched anywhere in the world. It's just too high. That being the case, it is one of the duties, and in fact one of the tasks which the insurance authority would like to work with members of the medical fraternity and so on, to bring out a template, a model, a pattern as it were, as to how we could make use of insurance and insurance principles to cover and make available health care to our citizens. Test models are there, and they have been very successful and exceedingly affordable. But we'll have to re-examine these models and to see how best we can build on them. Today, Dr. Ganapathy and his team have, and the entire seminar has focused on the ICT approach to health, and I'm quite sure that is a very valuable and cost-saving and efficient device, a mechanism to reach out to millions which are there in the country. I look forward to seeing how best that can be incorporated into standard medical protocols and subsequently into insurable medical protocols and insurable medical insurance policies. At the moment, though, what is covered under a given policy is really determined by the insurance industry. And given the uncertainties in the wider market, in India, like in very many countries, certainly in Asia, insurance cover is available only if a person is an inpatient in a hospital. There are a few exceptions. There's few widening. With greater accountability and transparency in transactions outside a hospital, perhaps more and more outpatients processes and procedures could be covered. But that day is still to come upon us. So gentlemen, once again, the IRDA, one other thing where in an area where we have been working with the medical fraternity is, as Mrs. Reddy had mentioned, we have 6 working groups, study groups, with the various, with the CII is a set of 3 of them, and with the Federation of Indian Chambers, the FICCI, another 3. And we are trying to work out systems and systematically improve various mechanisms in the entire health insurance sector. There are some difficulties, and in this, one of the serious handicaps we find in the insurance sector is that we do not have, let us say, a sufficiently representative and active self-regulatory organization in the medical space. There are, of course, the medical councils and the IMA and so on, but they are not particularly engaged in the practice of medicine as much as they might be. Perhaps it is time, for instance, in the insurance side, we wanted to set up a health council. That is a forum, create a platform where health providers, insurance companies and others could meet to resolve their issue, to discuss matters and improve the entire process, improve the entire infrastructure on this aspect. But unfortunately, one of the problems we face is in locating who might be appropriate representatives of the medical industry. And therefore, if there were some kind of a self-regulatory organization which has the trust and the confidence of all its members, then that would have been a tremendous help in building this council and working with them and involving various solutions as we go along. I'm confident that the fraternity of doctors who are here assembled in the wider parts of the country have certainly taken note of this, and I'm sure, and I look forward to the day when they come together and build this body, and perhaps on a platform like this, we can then have beginnings of when we can work together. As it stands, in the working groups of both the CII and the FICCI, there are very many large hospital groups which are represented, and so in a sense, the work which we have already embarked upon is fully consultative. But there are much larger establishments, not of the dimension and size of Apollo and so on, but who provide yeoman service in their fields too. It is that section which we feel we are not able to reach out or encompass within these committees. And therefore, there should be an appropriate SRO, which I look forward to you building. Dr. Reddy, you have in very many ways laid the alphabet for modern medical care in India, the methodology to be approached. And from the initial words and alphabets which you set up, we are now beginning to make small words. And I think this conference, heralds the sentences which have been formed. And I look forward to working when we get to building paragraphs and even pages. Ladies and gentlemen, I thank you for this opportunity and this platform. Thank you.
I request the Chairman, Dr. Pratap C. Reddy, to felicitate Mr. J. Hari Narayan. I request the Chairman, Dr. Pratap C. Reddy, to address us.
Namaste. Your Excellency, the Governor of Andhra Pradesh, Sri Narasimhan Garu, the Chairman of IRDA, Sri Hari Narayan, Sangeeta, Professor Ganapati, and all of you who made this possible, who I hope for the time that you have spent will pass on the larger benefits that we are looking for. I am reminded about 4 years ago, during a valedictory function at World Health Summit in Washington, the President of the United States apologized, saying I couldn't come to your function, but he appeared on the television and asked all, how many of you think that you have learned how to contribute to patient safety? He said, how many of you have learned that you can do things better and make it more accessible to people, and most importantly, what the country is facing, the cost. How can we give quality access for people with lesser costs? So I think the team today, Your Excellency, has addressed these issues. 3 days ago, when they had this patient safety for the whole day discussed, they went threadbare to see where are the lapses. How do we ultimately say that every single patient who attempted to give the best of quality, best of outcomes, and of course the cost benefits that he rightly deserves it. But then, what does this make a difference? All of our doctors for ages have been saying, we as doctors have this philanthropic attitude and we have taken this oath, Hippocrates oath. But I think the oath that they have taken here is, we have brought this into processes. A documentation processes which does not allow us to put anything under the carpet. We have made it possible that we monitor the patient from the time he comes in till he goes out. So I think the patient safety, the whole day discussions and the various processes that have been decided will be circulated to them, and which should make a very significant difference for the hospital groups at all levels. Sri Harinarayan very rightly put out, yes, there are a large number of big players like us, but there are a number of other institutions which are caring. It's they who need this. And this is why I think we have made a particular access in preparing this patient safety, that it trickles right down there. And the suggestion that you have given, that we should have an association which will represent us, which will come to you and then say what's good for us to continuously enable us to deliver quality health care. I think it's happening on Monday. On Monday, the Health Council of India is being formed, which will be an organization which will represent the various hospitals at all levels and all others who are associated with hospitals, because today we know, and that's what has been demonstrated in the last 2 days, that there is so much that we can do by using the technology. The technology has played a significant role in healthcare. I remember the simple exchange that we had today. We are talking about 320 slice CTs, 640 CTs, and the therapeutic measures that have taken place, especially in cancer. We have everything that can make a very significant difference, both in diagnosis and the management of those disorders. But I think what's most important in the deliberation that we took these last 2 days is to transform healthcare so that we can do a quantum leap in the level of reaching people at the last mile. I think the technology, we all know, is phenomenal. But I must remind, my wife is not here, I can say, she dealt with a computer the size of probably half this stage, which dealt, the data that's now available on your mobile phone is 1,000,000 times more than that large computer. That's the size. But what do we do with this? I think this is where we have decided that we'll take a quantum leap in the healthcare delivery, in quality, in outcomes, and most importantly, in the access. Consistently we have heard, our health ministers, our prime ministers constantly saying, how do we give the access to people who are in the remote places? Yesterday we heard the National Knowledge Work, NKN, National Knowledge Network, which has been rolled out, and Sam Pitroda told us a few months ago, saying, we are planning to introduce more than 100,000 of these nodes, which will touch almost every 6,000 people in the remotest part of the country. As health players, what we are pledging is we will ride along this NKN and provide the health care to the last mile. I think this is something which has come very clearly in all, saying there is this great tool that is now available for us. We have started telemedicine 10 years ago in the same place when His Excellency Bill Clinton, his last visit as President of the United States, visited. He launched Connecting Our Village. Professor Ganapathy has been responsible to developing telemedicine in the country and for Apollo and for the country. And that day we launched from the village connectivity. Probably there are about 1,000 telemedicine connectivities here which enables people from remote places to get an access to the doctors. What we pledged is we'll take it to several thousands of connectivities because we have this 3G, we have the broadband, we have the NKN. Using all of these, I think we will use the technology for transforming the way healthcare is given, transforming the way how we can take the healthcare to the people who deserve as much as anybody who is living in the metros. I'm very happy. I want to congratulate the entire team of organizers who have coordinated in making this happen. I'm very happy that Sangeeta is going to announce saying we'll do it again. But I'm saying that we can do it bigger, better, and more importantly, we can make it in such a way that it will certainly make a significant difference in the way healthcare is being delivered. I'll fail in my words if I don't acknowledge His Excellency the Governor of Andhra Pradesh, Sri Narasimhan Garu, who have been here, who have always been very candid. Whenever he talks to us, he's saying, let's talk not the numbers, let's talk what's the quality, what does it cost, how does it really matter in improving. I assure you, sir, your presence today will reinforce our various discussions that we had in the last 2 days, and also I'm very happy that you didn't just want to address and leave us. You said, I would like to see what your deliberations over the last 2 days have been. I promise you, in the next 24 hours, we will have an entire copy of the proceedings of the patient safety which took place day before yesterday and the proceedings of the IT transformation of healthcare in the last 2 days. Thank you again. We are all grateful for your presence here today. Mr. Harinarayan, we have no way of thanking you for directing the health insurance, which is really the access for people. Because we all belong to the same immortality feeling. That guy gets a heart attack, this guy will get a stroke, he is in an accident, nothing for me. But there need to be a mechanism when we really fall sick. And at that time, most of the time, it's not he is involved. It's a family member who is involved in taking him to the best possible place and taking care of the cost. We thank you for bringing several regulatory mechanisms to see that the access to healthcare reaches a lot of our people. I think in percentage-wise, we are still in a dismal figure, but I think the various regulatory mechanisms that we are bringing should add a significant value in rapid growth of this access to good quality healthcare. Thank you all very much. Thank you.
Ladies and gentlemen, the moment we all are waiting for, the address of His Excellency Shri E.S.L. Narasimhan, the Governor of Andhra Pradesh. Sir, it's my privilege to welcome you to address the gathering.
The name that is normally associated with Aushadam or medicine is Hari or Narayana, and we have him here in our presence, respected Mr. Hari Narayana. Pratap, the valorous man who always represents adventure in the medical field, Dr. Pratap Reddy. Of course, the most important thing for any venture is Vigneshwara, removing all obstacles. And I think Dr. Ganapathy has done more than his share of removing all obstacles for us. And the person whose name sounds music to all our ears, her great initiatives, particularly in enhancing healthcare, Sangeeta Reddy, distinguished delegates. Well, I am going to address this conference as a layman, the concerns of a layman, the apprehensions of a layman, the perceptions of a layman, and not as an expert. In fact, Sangeeta Reddy brought me here almost as an anticlimax to this great proceedings of the 3 days, but I still accepted it because I will be the one who will stand to benefit it. And if a common man comes to know what better healthcare he is going to get, I'll be able to probably spread this message better than most of you in this state. Well, health security, ladies and gentlemen, has today become an important component of national progress and development. It is no longer just personal health care. It is no longer a personal thing to be a healthy individual so that you can be all right. Because what we require today is a healthy nation. In fact, every time when I read that development is going on at a great pace, economic growth is hitting new highs, at the same time you feel saddened. You find that the BPL level is growing and the number of people who are looking for more health care, or if more surgical procedures are added every year and still we have crowd for them, which does not really augur well for a nation like India. I think what we require is much better health care and much better attention towards perfect health care, and not really resting ourselves with statistical information, but really correcting the perceptions of people. Whatever you might show to us by way of graphs and charts, ultimately it is a common man's perception which matters. In the perception of the common man, is he a healthy individual or not? Is the nation full of healthy individuals or not, is the question that I would like to raise. This being our criticality of health, are we giving it its due importance? I'm afraid not. This is what I think we need to really do. And if we are incurring such heavy expenditure as we are, is the benefit reaching the last mile, the common man? Or is it somewhere in between, is it getting stuck and it is not reaching the common man? If not, why not? I would just like to throw up some concerns for your consideration. You've getting neglected. In an era of mergers and acquisitions, can corporate hospitals pull in their resources and expertise and share their acquisitions over a much larger rural base that India is made up of? Is a question that I would like to raise. Because many times corporate hospitals and others go and conduct health camps in various rural areas, but it is confined to an ailment. But my question is, can we pull in the resources and can we send a team of experts from all these hospitals, say once a quarter, once in half year, to a select group of villagers, and can we thereby reduce the number of patients or reduce the number of people who are unaware of what ails them and give them the right treatment at the right point of time? Because you probably go in for screening them for cancer, and you find the man is down with, you find that tuberculosis is increasing on the one side. You find that cataract or glaucoma is increasing on the other side. You find some other ailment is increasing on the side. So can we pool in the resources of all these corporate hospitals and do this sort of a screening of our rural population? Why rural population? Even the urban population, which also, whose ignorance level also is pretty high when it comes to the medical field of medicine. Because basically everybody is scared of a doctor. I personally am. Because the moment you go to a doctor, now thanks to Sangeeta Reddy's IT, innovative idea of IT, probably all the records will be in one place. So next time I go to a doctor, he can't say that I think you'll have to give up sugar, you'll have to give up salt, you'll have to give up this, you'll have to give up that. Because then I say, look, I'm absolutely okay on my sugar level, this level, that level, I don't have to give up all this. So this care, I think, is something which is very, very important. And I feel that pooling in of expertise and resources and sharing your acquisitions with a larger base would be very useful. The other bigger thing is the cost factor. What worries the common man is the cost factor. Yes, of course, we have the Arogyasri program, as Harinarayana said, which covers a large bulk of the below poverty line people. But what about the next rung of people who are neither there nor here, who are neither rich nor poor, but come somewhere in between, but can't afford the cost of medical care? Can you look at the cost of medical care? Not only medical care, but medicines thereafter, which becomes expensive. Can we think of opening ATMs, all times medicine kiosks in various places, and stock them with mom's most used medicines? Because after all, the most used medicines, I think, are limited in number. We can always list out, probably might be about 100, 200 medicines which are most frequently used by people all over the place. can you store them in these so-called all-time medicine kiosks so that the rates are all fixed and people do get the supply? This will also help us to avoid a lot of seepage, because I think the government also spends a lot of money, the insurance company probably spends a lot of money on medicines which are very highly priced in some places. Can you thereafter make this affordable by going into some sort of an arrangement like this? The other issue that I would like to seek from the corporate hospitals is, as part of your corporate social responsibility, you are doing a lot for the poor people, for everybody. I don't deny that at all. But can each corporate hospital, or at least a group of them, repeat the Pratap Reddy's Aragonda experiment of opening hospitals for the rural places, and thereafter that becomes a hub for medical care in the district itself? Today, Dr. Pratap Reddy's Aragonda experiment, I think, is much spoken of in his home district, Chittoor district. So like that, I appeal to the corporates of Andhra Pradesh, can you repeat his experiment in your own villages, so that in each district we have one top-of-the-shelf hospital which is able to provide Medicare at an absolutely almost no cost. Well, he has started off with a 1 rupee or 2 rupee subscription for each individual, because freebies by themselves should always be avoided, is always my theory also. There should be no free lunches at all for anybody on any sector. So make them pay some minimal amount, and thereafter they'll realize the value of keeping themselves healthy, and you could probably think of opening such hospital Medicare everywhere. Teleconsultations. Yes, Apollo has made a breakthrough in teleconsultations thanks to Dr. Ganapati. Why don't we spread it? Why don't we get this into the government sector? Why don't we use this so that this will help people avoid traveling long distances to get Medicare? Today in the rural areas, many of them have to traverse long distances, and that prevents him from really going. Can you open more of this telecommunication? Can you facilitate more of kiosks where you can go to a center, say the village headquarters or some headquarters nearby, revenue headquarters, where you can get this telemedicine and get the care? The other question that I would need much time, many times is spoken of is there a need for a code of conduct on ethical practice for the medical profession? Probably not, but probably it will be useful also to dispel certain misconceptions which people do get sometimes. Of course, the patient safety, which has been discussed over the last 2 days, is one of the most critical features which I think is required today. It is a need of the day. How safe am I when I go into a hospital is a question that a patient always asks. Am I going to come back more sick than what I was when I entered the hospital? Is a question that is raised because of the infection levels, because of the care, because of the type of medicines that are being prescribed. With the use of IT and the patient safety measures, I think this perception is bound to get altered very much. The other thing is, of course, I don't have to be carrying my records everywhere. Thanks to Sangeeta Reddy's initiative, probably the whole thing should be available with the click of a mouse. And as I told you, it will also prevent duplication of tests. Anytime the normal perception, again, I may be wrong, gentlemen, please pardon me for saying this, is when you go to a doctor, he probably may like to repeat many of the tests which have already been done. Can we avoid that? Once we have this IT initiative, probably this sort of a contingency will also not arise, because we will probably be able to show him that this is my data already available, doctor. I have gone through all these tests. Please don't repeat them. I'm afraid some of these things will have to be looked into, and I think the medical cooperative movement is the need of the hour. In isolation, of course, we have islands of splendor like the Apollo is, but can we convert it into a cooperative movement of Apollos? Can we have more of Apollos coming up in the medical profession so that we have health security in a very big way available to us? And lastly, but most importantly, is the patient-doctor relationship, which I would like to say as a common man. For you doctors who are on a 24/7 duty all the time, please remember that for you, yes, the patient is one amongst 1,000. But for the patient who comes to you, you are the only one. Please remember that. Please be patient with a patient. This is something which I would request you, because a patient, when he comes to you, comes with a lot of concerns, comes with a lot of misperceptions, misapprehensions about his own health. He may ask irrelevant questions. Please be patient, because I know time doesn't allow you to be talking to every man for 15 minutes or 20 minutes. But give him the basic comfort level, and you will find that probably that itself works as a very good medicine, more than many of the medicines that we may be prescribing. ultimately I think it's the psychological medicine which helps. It's the individual's own well-being that is more important, and we need to do this. Well, I'm sure that the last 2 days deliberations would make a new beginning in the field of healthcare, and we will do a quantum jump, a great leap forward. And like Hanuman went and picked up the Sanjeevani hill, I think the last 2 days deliberations, I think we have probably spotted many such Sanjeevanis, Sanjeevani Sanjeevani hills. These will be taken, I'm sure, to the remotest corners of the country so that we have a healthy nation. And I think, as we always say, yes, I would like to meet Dr. Pratap Reddy as Dr. Pratap Reddy in a social get-together, but not as Dr. Pratap Reddy of the Apollo Hospital or Sangeeta Reddy as of the Apollo Hospital. I think I would like this country to come to a stage where we would like to make you, members of the medical fraternity, more on the social network than on a professional network, which means there is an onerous duty cast on your shoulders to make us all healthy. Well, health, gentlemen, ladies and gentlemen, is wealth, but wealth alone is not health. This is the baseline. We need to understand that. If somebody has to enjoy his wealth, he has to be healthy, and that is in your hands. As it is said, Dorkuna itvanti seva. I think it is your good fortune, it is your great good fortune that such a great responsibility has been cast on your shoulders. You are a 24/7 profession. You are a great group of people who provide life to people. Providing life, I think, is the biggest gift that you can give. What you give is pranadhan, and this pranadhan is unmatched. I don't think any other dhan. You can give any amount of land, you can give me any amount of houses, money, car, luxuries, but nobody can give life to another individual excepting you. This lies in your hands. Please use the IT, please use the innovative ideas, and please put your heart and soul as ever to provide a healthy and wealthy India. Only if India is healthy, it can be wealthy. Mere wealth will not get India a good health. Thank you very much for giving me this opportunity. I know I've spoken out of place, but pardon me for that. Thank you very much.
I request our chairman to honor His Excellency the Governor of Andhra Pradesh. Request Ms. Sangeeta Reddy, Executive Director, Apollo Hospitals, to talk on the way forward.
Your Excellency Sri Narasimhan Garu, Honorable Governor of Andhra Pradesh, sir, you said in your outstandingly inspiring address that you were an anticlimax at the end of the day. But sir, our judgment was right. You are an inspiration. You made the 3 days seem like just the preparation for a more invigorating journey ahead of us. And on behalf of every single member in the audience and on behalf of the healthcare sector, we promise you that your insightful, most appropriate questions have been deliberated on, will be worked upon further, and form an important part of the guiding path that we are taking forward to help make India a healthier nation. Thank you so much for your presence, for your continuous ability to challenge us further. Over the last 3 days, this tremendous group of people who are sitting in this room and a few who had to leave, I want to start out by thanking you all for being here and by just first saying namaste, and for everything that went well. I think the benefit, the credit goes to many people. If there were a few things that could have been done better, please make sure you tell us on the website, because like Dr. Reddy said, so many of you have come up and said, please repeat this conference. On behalf of Dr. Ganapathy, Gaurav, Dr. Hari Prasad, of course our chairman's support, we commit to continue this program, both on patient safety as well as on transforming healthcare, as a continuous process, maybe every 12 months or every 15 months. The dates will happen as we did earlier in a democratic process. Everyone will be sent emails. I have two important roles. One is to actually share a few of the thoughts. And sir, by your presence, Mr. Narasimhan Garu and Mr. Harinarayana, by your presence at this program, you put a seal on our promises. We are committing in front of you some of the things that have been deliberated, that they will not just be left in this room, but form the real guiding light of the way forward. Starting first with the International Congress on Patient Safety, the commitment number one, or the most important step of the go forward, was to create a joint action memorandum for a patient safety campaign. Because we found that many hospitals, multiple hospitals shared their framework, many were following good paths, many had found success and shared those as well. We said we would do a joint patient safety campaign and share this with nursing homes, with smaller hospitals, with individual doctors. Whether it was simple steps like washing hands to more complex steps like how do we create this joint formulary so that patient safety goes all the way up to medication safety, drug-drug interaction. It was complex deliberations. It was also finally decided that an executive body, including members from the Joint Commission, Ms. Ann Jacobson was with us, she has volunteered to be part of this, the National Patient Safety Forum, the QCI, that's the Quality Council of India, WHO has volunteered to be part of this, as well as FICCI and CII would be part of the executive body on patient safety to guide the hospital providers in the next step towards this. It was also planned to launch a joint portal to share best practices, and Express Healthcare Media has promised to dedicate half a page of every single publication to the Join Hands campaign on patient safety. So the deliberations will not just be deliberations, but form the basis and the foundation for a go-forward plan. And like one member in the audience came up and told me at tea break, 5 years from now, 10 years from now, we will remember that what we started deliberating on April 21st became the foundation for a safer and stronger healthcare system in the country. That is the most important thing that I can say. Moving forward to the next conference, I think the thought process that went behind the transformational of healthcare was one very significant thing, that each of us individually are making great strides. We're making incremental steps. We want to come together as a group so that we make transformational, outstanding movements which are not just incremental, but really exponential in their growth path. A few questions which came, which actually very interestingly share the thoughts of the Governor, the Honorable Governor. Sir, when you spoke of collaborative camps, I think the concept that came forward was that not only will we do camps, we will add to the camps. I hope that we will find a way to do them collaboratively, but the telemedicine network framework so far has been a one-to-one network. One individual PHC or one individual camp or one individual location to one hospital. We committed to come together in a many-to-many standards-based, unified, technology-driven platform so that many seekers of care and many potential givers of care can come together in an easy technology platform. This will transform the way rural India accesses healthcare. If of the 500,000 clinicians in this country, 80% of them are in the private sector, if one teleconsultation per day was committed to this rural network, if the government gave that framework to help us do that, that would be a transformational step. So our request is that the National Knowledge Network finds a way to allow the private network to ride on it, and the private sector will step up to say that we will create a true PPP virtual which will help in the real world. The next important thought process was the important initiative of the UID. So the joint action group of the healthcare informatics will be presenting to Mr. Nandan Nilekani on how we request that the UID get transformed to also serve at the next level as a UHID. a unique healthcare identifier as well, because when we have an identification, that forms the basis of the electronic medical record, which is the true transformational step. Sri Harinarayana Garu, all of us as healthcare providers are extremely cognizant of the fact that the insurance sector is the fuel that drives the healthcare engine. Your proactive steps so far in creation of formats and standards have really caught our imagination, and we would request that we play a more active role in the action committees. And we have only one thought process. We had multiple international players with us who spoke about the cost of the administrative back end of international healthcare. For every US healthcare dollar which is spent, 25 cents goes into back end administration. As a team, as a group, as a forum, as a community, we request that we find ways to make India have the lowest back end transaction cost. And it is only the insurance sector that can help us do it as the leader and as the most dynamic growth orienter. We request that be found a way. So one subgroup would request a chance to present in front of the IRDA on how we can do that. We also have with us volunteers on that, like Dr. Somil Nagpal from the WHO, who was also in the IRDA earlier. Multiple discussions happened on how we can take that forward. There were many things that were discussed in terms of commitments to create a national EMR network, to find ways to create a PHR, to give the technology to empower individuals. So I need to summarize by just saying that being able to say all this in your presence at the end of this conference gives each one of us in the audience the knowledge and the feeling that this will go forward. And that is truly inspirational and assists us. As one of our most important and intellectual speakers said, the last 3 days, when I said, what were the last 3 days about? He said it was about two things. It was about intelligence and it was about behavior. So I said, yeah, I'm sure we all know you're very smart. Tell me more about this. He said, no, as streams and streams of data are getting collected from the IT, from the Arogyashri, from individual hospitals, how do we convert that data into intelligence which is used for us? That's one of the commitments that we as a group want to make, because the standards and a joint framework will convert data into intelligence, which can be used for biosurveillance, for finding new cures, for many methodologies. The second aspect is behavior. What we have found that in a pilot stage, each of us are doing things which are truly transformational. But can we change the behavior pattern of how hospitals can assist through telemedicine in treating people in the village itself, like the Aragonda model, sir? Can we find ways that we keep patients out of hospitals and in the clinics, out of clinics and into home care? This is behavior modification for the way doctors treat, administrators manage, and patients access care. We believe that if the IBM's Wharton can play chess and win a game of Jeopardy, if Facebook can create a revolution and change a government, then can the Qualcomm, the mobile phone with the teledensity in India, find a way to change and put healthcare on the primary path of this. So we will help create business models which make better healthcare sustainable, whether it's the availability of clean drinking water or telemedicine. There are multiple dreams, there are multiple visions, there's so much passion. We thank you for being with us at this program. We also thank all our international speakers. It's been a wonderful beginning. We will continue in the days to come, because each one of us are not just healthcare providers, we're not just technology players. We are healthcare evangelists with a common dream of a healthier India and a healthier country. Thank you all very much for every single thing that's happened in the last 3 days. Very often, as we speak about programs, when a heart surgery is done, the cardiothoracic surgeon is the one who's thanked. And I often say there are many unsung heroes of medicines. The nurses, the technicians, the housekeeping boys. As so in this conference, there are two unsung heroes that, with the permission of the honorable members on the dais, call upon Gaurav Lohia, who really put together the National Patient Safety Conference, and request the Honorable Governor, Mr. Harinarayan, Dr. Pratap C. Reddy, to hand over a memento. Come, Gaurav. Come. And Suresh Kochetil, who put together the conference on the International Congress. All the delegates, please give them a big hand. Let's give them a big hand. There's so many other unmentioned names, but each one of you know that they have been special. Thank you all very much. The dream of a healthy India and that vision, that picture that we all had of a healthy child will continue to inspire us. So thank you very much for your presence.
I request Mr. Suresh to propose the vote of thanks.
As they say, all is well that ends well. 6 months of preparation, planning, meetings after meetings, numerous conference calls, minute-to-minute agenda, and finally 3 days of wonderful time. What does one need more? Behind this mammoth exercise of this nature is the hard work of hundreds of people, some seen, many unseen, some heard, some unheard. I wish to place on record the hard work of the team that went into making the International Patient Safety Congress and the second International Conference on Transforming Healthcare with IT a success. I wish to thank the sponsors, the exhibitors, and last but not the least, you, the delegates. We wish to thank His Excellency, the Governor of Andhra Pradesh, Shri E.S.L. Narasimhan, and the Honorable Chief Minister of Andhra Pradesh, Shri Kiran Kumar Reddy, who was here yesterday, for having taken time out from the busy schedule to be with us. We will meet again in October 12, that is 2012, October 2012. Please make a note in diary. Till then, ladies and gentlemen, it's goodbye. Thank you.
Ladies and gentlemen, let us rise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल वंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता